Welcome to the Dairy Digest. I'm Dr. Jackie Borman. In today's episode of the Purdue Dairy Digest, we will discuss some of the challenges of diagnosing pneumonia on dairy farms and how we may be approaching pneumonia in the future. As weather is warming up, we have to stay vigilant about monitoring cows and calves for pneumonia. In the Midwest of the United States, we have seen temperature swings of 70 degrees with high humidity. This environment is favorable for growth of bacteria that cause pneumonia. We now know more about the specific pathogens that cause pneumonia than we ever have, but incidence rates are still high. In the last USDA National Animal Health Monitoring System survey, pneumonia ranks as the second leading disease for pre-weaned calves, with 35% of calves being diagnosed as sick and about one-third of those being treated for pneumonia. In weaned calves, about 8% of them are usually treated for pneumonia, and that's usually with antibiotics. While we still have many effective antibiotics that we can currently use, it is time to reduce disease incidence as a way to also reduce antibiotic use in the dairy industry. Diagnosing pneumonia usually comes down to an elevated temperature, nasal discharge, and raspy or elevated respiration rates. Cows in the fresh pen may be diagnosed with pneumonia if they have a fever, but not obvious signs of uterine discharge or mastitis. When I look at metabolic disease rates for a farm, I include pneumonia incidence as well, for two reasons. The first being that cows are immunosuppressed and may be more susceptible to pneumonia during the fresh period. The second being that cows may be misdiagnosed during the fresh period, and the default is often pneumonia. A veterinarian once told me that when he listens to the lungs of a cow, it is just to give him more time to think. He usually can't hear very much. He may have been joking, but I think there may be some truth to what he is saying. It is often difficult to hear lung damage on a farm, and often pneumonia becomes the diagnosis because of the lack of other symptoms that point to another disease. Vaccinations are effective to reduce some cases of pneumonia. Sanitation and reducing stress so animals can combat pathogens that they come in contact are also probably our best bet. As I have said before, I think lung ultrasounds are an effective tool to diagnose lung damage. There is currently research being developed that looks at being better able to choose a treatment based on an animal's likelihood of responding, so we can limit the amount of treatment that is being administered. This is probably years from being commercially available, but is an exciting way to improve treatment outcomes for animals who truly have pneumonia.